Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering Hesi exit concepts that have been seen on Hesi. I do not write the exams. I do not keep track of questions, but what I do have are students that have taken exams before. When my students are walking around taking an exam, I like to look at the computer and I like to see what kind of concepts are being asked. And basically, guys, these are the same kind of concepts that you see students being questioned on for NCLEX, okay? So I'm going to be covering Hesi type concepts for the Hesi exit, and this is going to be probably more than a one-part series because there's so much to cover, but this is definitely video one, so just stay tuned for the next ones to be released. If you haven't done so already, guys, please be sure to like and subscribe below. Make sure you press that notification button so that every time a new video is released, you'll know so that you can watch. And of course, guys, if you appreciate my videos, if you appreciate the content, please be sure to share my videos and go ahead and leave me a comment if there's anything that you'd like to see me cover that I haven't covered already. So without any further ado, guys, let's get started. First question. A nurse administers an influenza vaccine to a client in a clinic. Within 15 minutes after the immunization was given, the client complains of itchy and watery eyes, increased anxiety, and difficulty breathing. The nurse expects that the first action in the sequence of care for this client will be to A, maintain the airway, B, administer epinephrine as ordered, C, monitor for hypotension and shock, or D, administer, guys, you know I cannot pronounce, diphenhydramine as ordered. That's Benadryl, guys. So I'll give you a moment to think of your answer. And so, guys, the correct answer is to give the epinephrine as ordered. How do we know? Let's go back and look what the question's telling us. So the patient just got a vaccine, and within 15 minutes, we're seeing itchy eyes, watery eyes, increased anxiety, difficulty breathing. The reason they got that increased anxiety is because they can't breathe. What are we seeing? We're seeing what is known as a true mediated response. Okay, if a patient was having, just a little mild allergic reaction, then 4 is a great choice. You'll give the Benadryl, diphenhydramine as ordered, right? But no, this patient is having a true mediated response. They can't breathe. Their airway's closing up on them. You better give them that epinephrine. Okay? So that's going to be your correct answer. So let's look at the other choices. A, maintain airway. And let me tell you, these test writers, that's how they trick you, because they know as a student, airway, I have to choose that. But it has to make sense. You need to make it make sense. How are you going to maintain the airway? By giving them the epinephrine. That epinephrine is what's going to open up the airway. Otherwise, you're just going to watch that patient die. Okay? Yes, you want to maintain the airway, but the way you do that is by opening it up, by giving them that epinephrine. So one's wrong. 3, monitor for hypotension and shock. We got bigger problems than that. Okay? This patient cannot breathe. Who cares about that hypotension if they're dead? So our first order of business is to make sure that they have a patent airway by giving them that epinephrine. Next question. Which of these children at the site of a disaster at a child daycare center would the triage nurse put in the treat last category? A, an infant with intermittent bulging anterior fontanelle between crying episodes. B, a toddler with severe deep abrasions over 98% of the body. C, a preschooler with one lower leg fracture and the other leg with an upper leg fracture. Or D, a school-age child with cinched eyebrows and hair on the arms. And I'll give you a moment to think of your answer. So guys, the correct answer is B, the toddler with severe deep abrasions over 98% of the body. Now guys, what I'm about to say to you, I know this sounds so bad, but it's the truth. In regular situations, when you're asked what patient do you see first, you're always going to run to the patient that's most unstable, the patient that's most critical. But in disaster situations, right, it's the opposite. In disaster situations, you want to help the patient that's most stable, the one that's most likely to live. And I hate to put it that way, but that's just the truth. You don't want to use precious time on somebody who's most likely to die, right? The little bit of time you have, you want to use it on somebody whose chances to survive are the highest. So whenever it's a disaster already in your mind, you need to say that the person who's worst off, you're going to save from last because they're going to be a goner anyway, chances are, right? And the patient who is most stable, that's who you want to help first because their chances of living are better. So let's go back to these choices. And the correct answer is B. The toddler with severe deep abrasions over 98% of the body, that's who you're going to help last. Why? Because they're most likely to die. Okay? I want you to think about it. Why is this toddler most likely to die out of everyone on this list? It's a toddler with the burns. If you watch my videos before, I go in depth with burns. You know, when it comes to burns, where the biggest concerns are dehydration, fluid electrolyte imbalance, of course, pain, infection. Okay, those four. We're very concerned about it. Well, think about this. This is a toddler we're dealing with, so their body surface area is even smaller. Okay, so their risk of going through dehydration, of having that fluid and electrolyte imbalance is much higher than that of the adult. Let's keep going with, it doesn't even say deep abrasions. It says severe deep abrasions. Remember, guys, I did that video on priority patients who are the worst off, right? Remember, severe is on that list I gave you. When you see severe, you need to be like, oh boy. So that's our second clue they told us, severe. And right after severe, it didn't even say severe abrasions. What did they say? Severe deep abrasions. This is painting a very sad clinical picture. This kid is going to be a goner, okay? And now, if we didn't get that, if we get those three hints, just to make sure that they hit it home, they told us over 98% of their body. So it's all over. This patient's most likely to die. Look at our other choices. 1, an infant. So an infant, the baby's less than a year old, right? Birth to 12 months, that's infancy. So we have an infant with intermittent bulging anterior fontanelles between crying episodes. So this baby's crying, all right? Now, we don't like that we see that's bulging between the crying, but the baby's crying, right? So they're somewhat stable. Let's keep moving. See, we got the preschooler that has a leg and an arm fracture. Then we have D, a school-age child with singed eyebrows and hair on the arm. So this child was exposed to some type of heat because it got singed eyebrows and hair. But this picture that's been given to us, by far the worst off is that toddler with deep abrasions over how much of the body? 98%. They are worst off, so we're going to save them for last. If we can get to them, great. But we want to make sure we get to the more stable kids first, okay? So normal circumstances, whoever's most unstable, you want to go to them first. But when it comes to a disaster, whoever's more stable, that's who you want to see first. It's kind of switched. All right, next question. The nurse is having difficulty reading the healthcare provider's written order that was right before the shift change. What action should be taken? 1, leave the order for the oncoming staff nurse to follow up. 2, contact the charge nurse for an interpretation. C, ask the pharmacy for assistance in the interpretation. Or D, call the provider for clarification. And the correct answer is D. You're going to call the provider for clarification. So guys, I've talked to you about this before, and I can't stress this enough. If you have a question about an order, you always have to go to the source. Whoever wrote the order, that's who you ask. Not a supervisor, not a coworker, not the pharmacy. You go to the source. Whoever wrote that order, you call them and ask for clarification. Now, if you have a question about a drug, you have 2 options. Go to the pharmacist or the drug book. You can't call the doctor and ask them about the drug. You can't call a coworker. You can't call your manager, okay? So if your question's about a drug, you're going to go to your drug book or the pharmacist. If your question's about an order, you're going to go to the doctor that wrote the order. A client has an order for 1,000 mLs of D5W to infuse over an 8-hour period. The nurse discovers that 800 milliliters has infused after 4 hours. What is the priority nursing action? A, ask the client if there are any breathing problems. B, have the client void as much as possible. C, check the vital signs. Or D, auscultate the lungs. And the correct answer, guys, you're going to do D, auscultate the lungs. You're going to assess. Why? Let's look at what's happening. So the patient was supposed to be getting 125 mLs per hour, but oh my gosh, when you go and check on them, you realize that more like 200 mLs per hour has been infusing into that patient. So that patient was getting too much fluid too fast. What are we worried about? That patient going to fluid overload and the fluid spilling into where? Their lungs, right? So you don't ask them, oh, are you having difficulty breathing? Listen to those lungs. Do you hear crackles? Look at that O2 sat. Look to see how they're satting. The first thing you want to do is assess. So the correct answer is auscultate, because when you're auscultating the lungs, you are getting objective data. So it's not something the patient's telling you. It's something you can hear. Something you can see. When you're listening to the lungs, you're auscultating, you can hear that. You can hear if it's clear, if you hear crackles, if you hear wheezing. If you look at the O2 sat, right, you can physically, visually see a number. Are they satting at 100, 99, 98, which is wonderful, right? Or, oh my gosh, are they at 88, which means they're going into acute respiratory distress. So you're going to assess. You're going to look at your patient, listen. Next question. Following the change of shift report on an orthopedic unit, which client should the nurse see first? A 16-year-old who had an open reduction of a fractured wrist 10 hours ago. B, a 20-year-old in skeletal traction for 2 weeks since an MVA. C, a 72-year-old recovering from surgery after hip replacement 2 hours ago. Or D, 75-year-old who's in skin traction prior to planned hip pinning surgery. And the correct answer, guys, is C, the 72-year-old recovering from surgery after hip replacement 2 hours ago. In this question, when they're asking who you're going to see first, what they're really asking you is who is least unstable. All right? And that's two, because remember, we talked about this, guys. Any patient that had surgery, I don't care what kind of surgery they had. I don't care if they had a C-section, knee replacement, I don't care. If they had surgery, right after surgery, they require in-depth assessment because so many things can go wrong, right? They can get a DVT, they can get a pulmonary embolism, they can get infection, they can bleed out and go through hemorrhagic shock. So that patient's not considered stable. You have to watch them very closely. So the most unstable patient is the patient who had surgery, what? 2 hours ago. This surgery was fresh. Let's look at our other choices. One, you have a 16-year-old who had a reduction on their wrist. How long? 10 hours ago. So we've been assessing this patient for 10 hours. Choice two, a 20-year-old who's in skin traction for 2 weeks after an MVA. We've been watching them for this 2 weeks. You have D, a 75-year-old in skin traction prior to hip surgery. We're watching them before the surgery, but that patient who just came out of surgery 2 hours, that's who's most unstable. That's who we're going to check on first. A client with a diagnosis of MRSA has died. Which type of precaution is the appropriate type to use when performing post-mortem care? A, airborne precaution. 2, droplet precautions. 3, contact precautions. Or 4, compromised host precautions. And your correct answer, guys, is C, contact precautions. Remember what this patient has, MRSA. So patients with MRSA, with RSV, with open wounds, you're going to put them on contact precautions. Now let's look at our other choices. You have A, airborne precautions. Those are your patients with measles, your patients with tuberculosis, your patients with varicella, right? Chickenpox. You're going to put those type of patients on airborne precautions. What's our other choices? Choice B, droplet precautions. Those are patients with mumps, influenza, pneumonia. You're going to put them on droplet. And then choice D, compromised host precaution. Now, compromised hosts, those are your patients that are compromised. They're immunocompromised. Their immune system's very weak. So we have to protect that patient from everyone else, right? They would be your HIV patients. Those would be your cancer patients. Those would be your patients who just got an organ transplant because they're on high dose what? Steroids, right? And so that would decrease their immune system, and we have to protect them from everyone else. The nurse is reviewing with the client how to collect a clean catch urine specimen. Which sequence is appropriate teaching? A, void a little, clean the meatus, then collect specimen. B, clean the meatus, begin voiding, then catch a urine stream. C, clean the meatus, then urinate into the container. Or D, void continuously and catch some of the urine. And the correct answer is B, clean the meatus, begin voiding, and then catch the urine. Why do we do that? So you clean the meatus, right? Of course, you always want to clean the patient. Allow them to urine. Allow that urine stream to begin. And then in the middle of that urine stream, then you want to catch the urine. Why? We want to catch what was sitting inside of the bladder, not what was sitting in the urethra. Not what was sitting in the meatus. We want what was inside of the bladder. So that's why we're catching it after the patient's already began voiding. So what was in the urethra and on the meatus has already gone into the toilet. Then what you catch, you know for sure, that's what was in the bladder and not anywhere else. Next question. The provider orders naloxone 0.125 milligrams by mouth and furosemide 40 milligrams every day. Which of these foods would the nurse reinforce for the client to eat at least daily? A, spaghetti, B, watermelon, C, chicken, or D, tomatoes? And the correct answer, guys, is B, watermelon. Why? What is watermelon high in? Potassium. So when you guys saw this question, you were expected to recognize, oh, my patient's taking digoxin. And I know that if a patient has hypokalemia, it can cause the patient who's taking digoxin to go through dig toxicity, right? So when a patient's taking digoxin, you want to be watching those potassium levels and making sure that the potassium is between 3.5 to 5, because 3.5 to 5 is the normal potassium range. Anything less than 3.5, which is hypokalemic, can cause that patient to have dig toxicity. Okay, are you guys following me? So let's go further. We see that they're taking digoxin and they're taking furosemide. What is furosemide? Lasix. What does that L in Lasix stand for? It stands for losing. You lose potassium when you take Lasix. So my patient taking digoxin that should not have hypokalemia, but they're taking Lasix, so they're losing potassium, that's going to put them at risk for getting dig toxicity. So we need to make sure that that patient's eating foods high in potassium. Let's remove digoxin for a moment. Let's say the patient was not on digoxin. They were just taking Lasix. Guess what? Even with digoxin being out of the picture, a patient that's taking Lasix is going to lose potassium. They still need to eat foods high in potassium, so you still give them watermelon. Okay? All right, guys. Oh, by the way, don't forget I told you your potassium level is 3.5 to 5. Don't forget your dig level, 0.5 to 2. That's your normal dig level. Once a patient hits 2.5, they're toxic, okay? A nurse is stuck in the hand by an exposed needle. What intermediate action should the nurse take? 1, look up the policy on needle sticks. 2, contact employee health services. 3, immediately wash the hands with vigor. D, notify the supervisor and risk management. And the correct answer is C, immediately wash the hands with vigor. You get pricked, the first thing you're going to do is wash your hands. And you're not going to wash your hands willy-nilly. No, you're going to wash your hands vigorously. That is the first thing you're going to do. Okay? After you wash your hands vigorously, then you're going to notify your supervisor, because your supervisor has to be notified. Then they're going to send you up to employee health. You're going to get your prophylactic antibiotics. You're going to get tested, all that good stuff. But in that order, wash hands vigorously. Let your supervisor know. Then go ahead and go over to employee health so you can get your prophylactic meds and get tested. As a nurse takes a history of a 3-year-old with neuroblastoma, what comments by the parents require follow-up and are consistent with the diagnosis? A, the child has been listless and has lost lots of weight. B, the urine is dark yellow and small in amounts. C, clothes are becoming tighter across her abdomen. D, we notice muscle weakness and some unsteadiness. And the correct answer is C, clothes are becoming tighter across her abdomen. So guys, neuroblastoma, that's the tumor that's either on one or both of what? The adrenal glands. Where do the adrenal glands sit? And usually it's one tumor. Patient hardly ever has both. But anyway, where do the adrenal glands sit? On top of your kidneys. So if you take your two hands and put them behind your back like this, where your palms touch, those are where your kidneys usually sit. And your adrenal glands sit right on top of the kidneys. Neuroblastoma is having a tumor on that adrenal gland. So what happens is if that tumor starts growing, right, the parents are going to notice that the child's clothes are getting tighter. Right? It's harder to, if they used to loop the belt on the third hole, right? Now they're looping it on the fourth or fifth. Why is it getting tighter? Because the tumor is growing. So that is the correct answer. A 16-year-old enters the emergency department. Excuse me. The triage nurse identifies that this teenager is legally married and signs a consent form for treatment. What would be the most appropriate action by the nurse? A, ask the teenager to wait until a parent or legal guardian can be contacted. B, withhold treatment until telephone consent can be obtained from the partner. C, refer the teenager to a community pediatric hospital emergency department. 4, proceed with triage process in the same manner as any adult client. And the correct answer is 4. You're going to proceed and treat them as an adult. Why? They are legally married. Okay? So the patients who are underage that you're going to treat as an adult are patients who are legally married. Patients who are in the armed forces, such as the Army, the Navy. Patients who have been legally, what's the word I'm looking for? Emancipated, who've been emancipated by the court. By the court, they've been deemed adults. Those type of patients you are going to treat as an adult, okay? Now, one more thing I want to discuss with you. If you have a patient that's underage and they come in with their child, they are allowed to make decisions for their child. Even though they're underage, if it's their child, they can make the decision. But themselves, if they're not legally married, they're not in the armed forces, they have not legally been emancipated, they cannot make decisions for themselves. The parents have to make decisions for them, but they can make decisions for their child. The nurses admitted a 4-year-old with a diagnosis of possible rheumatic fever. Which statement by the parent would cause the nurse to suspect an association with this disease? A, our child had chickenpox 6 months ago. B, strep throat went through all the children at the daycare last month. C, both ears were infected over 3 months age, Or D, last week both feet had a fungal skin infection. And the correct answer, guys, is B. Strep throat went through all the children at the daycare last month. So this is something else that I've talked about in depth, okay? So This is why it's so important. These children that get strep throat, because normally it's children that do get strep throat, it's important that they get swabbed. And we test them to make sure that they don't have group A strep. If they get strep, a 99-cent antibiotic will clear it up. But if that patient does not get treatment right away, it resolves on its own. What happens is that patient makes these antibodies to the strep, right? And later down the road, you want to know what complication they can have? Rheumatic fever, glomerulonephritis from that strep that they had previously. Okay, so it's very important for you guys to know the complications of strep, glomerulonephritis, and rheumatic fever. So once you see strep, and they're asking about maybe what the complications, that's what needs to be in the back of your mind. So of course, if we're suspecting this patient has rheumatic fever, one of the things that might clue us in, oh, okay, this is probably what's going on, is if the mom says, yep, you know, in the daycare, a whole bunch of the kids did have strep. Uh-oh. All right. All right, guys, we're down to our last question. A client has been admitted to the coronary care unit with a myocardial infarction. Which nursing diagnosis should have priority? A, pain related to ischemia. B, risk for altered elimination, constipation. C, risk for complication, dysrhythmias. Or D, anxiety related to pain. And I'll give you a moment to think of your answer. All right, guys, if you've been watching my videos for a while, I know you know what this answer is. A, pain related to ischemia. So guys, you know I say this all the time. Pain never killed anybody. When it comes to Maslow's hierarchy of need, physiological integrity, pain's all the way up there, right? It's not a priority, except in 4 situations. In 4 situations, pain is such a priority that it can be life or death for a patient. What are those situations? Sickle cell disease. If a patient is going through sickle cell crisis, you treat that pain as a priority, as if their physiological integrity is at risk, because guess what? It is. Stones. I don't care if they're calcium. I don't care if they're struvite. Stones, gallbladder stones, kidney stones, that type of pain is so horrendous that patient could go through shock. You need to treat that pain as a priority. What is our third one? Burns. Burn pain. That pain is so severe that can put their physiological integrity at risk. Okay? Burns, pain is a priority. And the 4th one, heart attack. Patient has a myocardial infarction. You absolutely must treat that pain. You're going to give them what? Morphine. Why? Because if that patient's in pain, the oxygen demand is increased. Can that heart, who just stopped a little while ago, afford to have increased oxygen demand? If your oxygen demand is increased, that means your body's screaming for more oxygen. How are they going to get the oxygen? The heart has to pump faster to push out all that blood that carries the hemoglobin, that carries the oxygen. Well, guess what? A patient who just had a heart attack, that just had an MI, we want them to rest. We want that heart to rest. So guess what? We are going to treat that pain. We're going to give that patient morphine. Okay? So MI, sickle cell, burns, and stones. Pain is a priority. All right, guys, so my time is almost up. I hope you guys enjoyed this video. Again, please share this video with anyone you know that will help them. If you have friends that are in school right now or studying to take their boards. If you haven't subscribed already, please be sure to do so. Like this video, and of course, leave a comment for me if there's something that you'd like for me to cover that you haven't seen yet. Thank you for spending this time with me, and I'll see you next time.